this is fit for purpose. With these words, I support the motion. Mr. Jeffrey Lam. Madam Deputy, the debate today is promoting healthy aging to create good quality of life for the silver-haired group. That is, senior citizens are sometimes described as useless, and this is really disrespectful. The old folks have been toiling hard all their life for the prosperity of Hong Kong. We have to offer some reward for them. We should show them all the support and care that they need so that they would be able to live out their lives in dignity. In Hong Kong, it is very much an aging society. 1 in 5 of the people in Hong Kong are old people. And the focus of the government's attention is not just to promote respect and care for the elderly, but also to formulate the right policy to provide comprehensive range of services. The BPA released a report to urge the government to respect, support the elderly and formulate the right policy in this area. We have to have the policy blueprint to be formulated in the northern metropolis and other places. We should have the elderly centers. Those aged 65 should be given the fruit money, and the $2 transport concession should also be maintained. There should also be a fund for the care of the elderly. I hope the administration will consider these. In terms of care for the elderly, if you open the newspapers every day, you get to see a lot of old people who got cheated out of their life savings. Some of them lost their shirt totally. There aren't many thugs or swindlers who are living overseas. It would be hard for the police to enforce the law. I think there can be a simple platform for reporting suspicious activities for the elderly. There are some wellness companies that are dressed up as caring for the elderly, and they are swindling or scamming the senior citizens out of their money. And there can also be some mechanism to guard against deception of the old folks in Hong Kong, and the police can step in and prevent the problems from happening in the first place. More importantly, the government should extend the retirement age, and the young olds should be encouraged to work. The whole world is poaching talents. Hong Kong is running out of talents. Now, some young olds are really capable, they're competent, and they have an agile mind. Why did they have to be retiring so soon? In August this year, Singapore has rolled out a scheme whereby the government spent $7 billion or 43 billion Hong Kong dollars to encourage the senior citizens to continue working. And in Japan and other parts of the world, they've also extended retirement age to 67, 68, or even 70. I propose that the administration roll out a scheme to extend the retirement age of the civil servants. And through policy measures, the NGOs, the large corporates should also be encouraged to follow suit. And there should be a culture fostered of old people being energetic enough to continue working. Finally, I urge the administration to devote more resources to encourage body check. Prevention is always better than cure. If the symptoms are picked up early, they can be better cure. I urge the administration to, while promoting primary care, to have PPP scheme to support the healthcare workers, to offer body check for the senior citizens, and health talks to minimize the rate of chronic diseases. Thank you.
Ms. Jovi Chen. Thank you, Madam Deputy. I'm grateful to Mr. Adrian HO for moving this motion to promote healthy aging to create a good quality of life for the silver-haired good. Mr. Chairman Kwong talked about poll he did, that is the number of times this council has debated a similar topic. I've checked as well. In July 2021, there was a similar motion moved by Mr. Chen Kim-po on promoting public health policies to enjoy quality retirement life. It's a similar motion. It goes to show that to enhance the quality of life of our elderly persons, we should protect their health and ensure social participation. It goes to show that all terms of the council are concerned about this topic. Last time, 12 members spoke on this, and for this, a few more members have spoken before me. They are all concerned about topics related to the health of our elderly persons. Last year, the country announced the plan for the development of national undertakings for the aged and elderly care service system during the 14th five-year plan period to promote healthy aging. Now, we always want people to age and stay in place, and we should take care of the basic needs of the elderly, and we should ensure that they have a sense of belonging, they belong to the families and the community, and also to help them to unleash their potential and enhance their self-worth. And in the 14th five-year plan, there is also the notion of happy elderly. In fact, our life expectancy for 7 years in a row have topped the world. Latest statistics shows that for female life expectancy in Hong Kong is 88 and 85 for men. So we have more old people living longer. How can we ensure that they live a happy and healthy life? Of course, we need voluntary universal retirement protection for everyone, something the FTU has been asking for a long time, and we have to enhance the quality of life that can start from support for singleton elderly. We have over 180,000 elderly singleton households, and we are concerned about that subject. We held a roundtable meeting on our policy in this subject. We invited elders and also experts to explore the needs and also the challenges faced by elderly singletons. Earlier on, together my colleagues from FTU, that is Mr. Lok Jun Hong, released a report of our study. We raised a number of measures to alleviate the pressure and also the problems faced by the elderly. We have 188,000 elderly singletons that are over 65 years old, and for the HD, records show that there are 120,000 such households. 148,000 of them are over 85 years old. Now, we used to say that people can live 100 years, but now life expectancy can be as long as 120 years. In public housings, it's quite frequent that we see elders over 100 years old. So we have a 4-tier structure for supporting the elderly: personal and community and elderly center. We can have the uniform assessment now to screen out the frail cases. They are high-risk cases and they should be tackled. And then on a neighborhood basis, we can rely on care teams. Community, that is cooperation between the security guards and also the neighborhood. And lastly, we can have an opt-out system so that all elders can be automatic members of elderly centers. So we have proposed this to the government. Lastly, Mr. Adrian HO, when he spoke on his motion, he talked about Mr. Lai. Apart from taking potions, and I think we should encourage people to create a good quality of life. And this one way is by boosting fertility. Mr. Adrian HO can consider this. As regards our population policy, we had a motion on that already. I will not repeat my views there. With these remarks, I support the motion and the amendments. Ms. Lam So Wai, I'm grateful to Mr. Adrian HO for moving the motion and the other 3 members for proposing amendments. The topic is how to create a good quality of life for our young people. Now, the government is going to inject another $1 billion into Tech Fund to support elderly service units to procure elderly care needs appliances such as super low beds and also intelligent anti-wandering systems. I really support such a move. With technology advancement, the application of Tech products can lessen the burden on carers, and it can also encourage aging in place, thereby enhancing the quality of life of our elders. Common products are those for lifting and eating aids, anti-slip devices, and also smart wristbands. With such products, elderly persons can live happier. The government should invest in promoting Geriatric technology. In all 18 districts, we should have Geriatric technology ambassadors to assist elders and their carers to understand how to use such products. The community care service voucher can be used for hiring or leasing such products. The purpose is to promote aging in place. And we have to ensure that elders will not lease the wrong product leading to accidents or misuse of resources. We must enhance the society's understanding on how such products can be used. We can enlist the help of care teams and NGOs in training Geriatric technology ambassadors. In particular, we can promote employment, women employment. We can train women to serve their local elders. This can promote local employment, and we can boost job opportunities for our women. And such ambassadors can communicate with elders. This is particularly useful for elderly singletons or elderly couples because very often they are isolated from society. This move can enhance social harmony and add self-worth to our ladies. Geriatric technology is being applied widely all over the world, and the trend is increasing, whether it be Taiwan, the mainland, Japan, or Europe. They have elderly villages. In Shanghai, they have a community pilot scheme for the elderly. By making use of Geriatric technology, now if an elderly person living on his own hasn't gone out for a while, then the device will notify a platform automatically. And then in Taiwan, they have a special community for dementia elderly, so that the elderly persons can move freely within the community. So can we consider setting up a similar community for elderly persons with dementia so that they can move freely in a safe and secure environment and they can age with dignity? Because we have an increasing number of elders with dementia in Hong Kong, and they are very difficult to look after. So please consider this proposal. In the policy address, it is said that we should have a manual for building design. Now, in this design, we can have new buildings for elderly person. In terms of illumination, there can be sensors, and we can have anti-slip devices. There can be sensors, and we can have a space reserved for installing hoists, so that when the impairment increases, the elderly person can still age in place. With these remarks, I support the motion and the amendments. Thank you. Mr. Kingsley Wong. Thank you, Madam Deputy. I speak to support Mr. Andrew Ho's original motion, promoting healthy aging to create a good quality of life for the silver-haired group, and also the 3 amendments. Our population is aging. According to property projection, by 2046, over half of our people will be elderly persons. 1 out of every 3 people in Hong Kong is an old person, and this is a topic we have to study. We have got the plan for the development of national undertakings for the aged and elderly care service system in the country, and their elderly persons are encouraged to continue to contribute to society, and there should be proper laws and rules in place to ensure the right to work for and to do business for the elderly. We don't have something similar in Hong Kong. Now take the old age living allowance as example. Now the income limit for a singleton and an elderly couple is just 10,580 and 16,080 respectively. As a result, many elderly persons who want to keep their full-time job have no choice but to turn to part-time jobs in order to be eligible for OALA. The purpose of the allowance is to provide extra financial support to those who are aged 65. However, because of the low income limit, this has discouraged elderly persons to keep their jobs. Now we want our young people, our old people to live happily and healthily, and we want them to be productive. There should be policy support for elderlies to keep being employed. So the income limit should be lifted. And also the asset limit, while the asset limit can remain the same, so that eligible elderly persons can continue to receive OLA and to encourage them to keep their full-time jobs. So for elderly persons who are in the 25th percentile of the income, that is below 14,800 or 22,500 for a couple to remain eligible for OALO. That can encourage them to keep their full-time jobs. I hope the administration can echo the national policy and unleash the potential of our elderly persons so that they can continue to be in the workforce. Thank you.
Dr. David Lam. Thank you, Deputy President. I support Mr. Adrian HO's motion on promoting healthy aging to create a good quality of life for the silver-haired group. Healthy aging means happy aging. Good health and happiness, they go together. They also have to do with dental health, mental health. Health is something we need to start at a young age. So I support the primary health care initiative about a healthy life. At different stages in life, we need to set health targets. We need to start with each and every individual. Every one of us is the one with the primary responsibility for our own health. We need to reject bad habits like drinking and smoking. Family doctors are vital. We need a well-developed primary health care system. Health means we need to start with prevention, a healthy lifestyle, healthy diet that takes education. Timely screening also matters for hypertension, diabetes, and dementia. We need to protect them from falls. Regular dental care, we need to teach people about dental hygiene. We also need comprehensive elderly care so that there is a sense of security for seniors. That will mean less worry for seniors and their carers. That will also be good for the mental well-being of seniors and their family. In the community, we need to encourage neighborhood spirit. In the community, we need to identify those at greater risk of mental health issues. We need points of contact. We need to encourage a neighborly spirit. This can also help address the mental health crisis in the community because we will have earlier intervention. I propose mental health support teams. We will need psychiatrists. Here, public-private partnerships can come in. We can also involve family doctors and nurses at district health centers, occupational therapists, psychologists, social workers, teachers, and also counselors. Here are some ideas for the social welfare department. We need a centralized approach to the cases at the SWD. Coordination would show us where cases are going and how they are dealt with. The SWD should also launch its own version of the e-health platform. That way, service providers can input the information into the system so that the same person getting help will see their information shared among service providers, and we will have records of all that. My third suggestion is that the SWD should work with the primary healthcare office. When needed, there should be access given to the e-health records. That way, family doctors, psychiatrists can access the mental health records and they can tell whether there are lifestyle issues with a person. Now, also some ideas for the health bureau. Let's do more on mental health. Under the Commissioner for Primary Health Care, can we have a deputy commissioner dedicated to mental health to coordinate community-level mental health efforts and set up a platform for medical sector teachers and the community? Seniors have a lot to offer. They have experience, they have knowledge. We should also teach young people to honor and protect our seniors. That's part of our Chinese culture, and that can also contribute to healthy aging. Now, LegCo is pushing for this. I hope the government can also take the lead. I support the motion from Mr. Adrian HO and amendments. Reverend Peter Kun. Deputy President, we just had the 8th athletic games for seniors. I was pleased to see athletes in their 80s. They were sprightly, very active. This shows healthy aging works. Hong Kong is known for the longevity of its residents. We are just behind Japan in the number of people aged over 100. But does living longer mean a better life? More than 70%, that is 75% of our seniors have 3 chronic illnesses. Nearly half of our seniors cannot look after themselves from day to day. 45 and nearly 60% of seniors have visual or hearing impairment. Living longer may become a torture if people live longer with more impairment. Healthy aging is by no means easy. As we have more seniors in the community and there are more of them in absolute number, the government needs to cope with this challenge, and this means reviewing existing policies and also the demographic structure. What matters even more is to help seniors stay healthy physically and mentally. We need to improve their quality of life so that seniors can lead a happy life and live with a sense of purpose. A healthy life for seniors will mean attention to lifestyle and spiritual needs. Exercise helps. It can also contribute to mental well-being. A study shows nearly 90% of Hong Kong seniors fall short of the WHO standards in terms of exercise. Nearly 10% of our seniors do not exercise. To get to the root of the problem, we should do incentive schemes to encourage seniors to walk. We need incentives to encourage seniors to exercise regularly. There are community halls and community centers. They have multi-purpose halls or activity rooms. The usage rate is roughly 40% on average at these venues. The government needs to do more with these facilities. Let's organize group activities for seniors at these venues, say concerts, competitions. We can also do subsidies for organizations to set up sports events. The Jockey Club has an initiative for seniors to exercise. This can also help seniors find a hobby, expand their social circles, and delay bodily decay. Encouraging exercise is one idea. Another option is to encourage seniors to keep learning. Continuous learning matters. Seniors can keep learning, keep pace with the changing times. This can also contribute to their mental health. There should be more government publicity on the Elders Academy. Based on what the seniors are interested in, we can have different training programs. We can bring together the public and private sectors and offer a rich variety of learning resources and opportunities for seniors. Many seniors need public health care. They have to wait for a year before getting care, like cataract. Their vision blurs, and eventually they lose their vision altogether, and even then they cannot access a doctor. This needs to be fixed. With ever faster development in the GBA, cross-boundary elderly care in the GBA can be a new option for seniors in aging. I so submit. Dr. Kennedy Wong. Madam Deputy, as people age, their hair grows gray. They lose some of what they used to have. That's inevitable. But well-being covers more than that. I support Mr. Adrian HO's motion on promoting healthy aging to create a good quality of life for the silver-haired group. I also support the amendment. A study shows that between 2007 and 2020, for men and women aged 65 and above, the average long expectancy went up by 3.7 and 2.1 years respectively. But for those without disability, the increase was only 1.8 and 0.1 years respectively. This means Hong Kong people are living longer. But before people pass away, they develop different disabilities, and that leads to stress on our public healthcare system. That makes healthy aging policies all the more important, especially for chronic diseases. I declare my interest as a chairman of the advisory panel at the Hong Kong Baptist University. I have been championing preventive medicine with Chinese medicine. The Jockey Club gave $90 million for the HKBU to set up a Chinese medicine center. We adopt traditional Chinese medicine. The goal is to achieve preventive care. For the chronic illnesses, Chinese medicine can be applied to prevent the condition from worsening. And then in rehabilitation, Chinese medicine can help prevent relapses and wellness maintenance. Preventive medicine in Chinese medicine can help with the goal set out in the motion, and that is delaying the development of disabilities. This can contribute to the well-being of the silver-haired. To promote this idea, we need to promote Chinese medicine services among the silver-haired. Here, the government should provide support in resources and venues. With housing estates that have more seniors, we should set up centers for preventive medicine to care for those who need it. This can help reduce the long-term cost in public health care. On building an elderly-friendly community, gerund technology can help. But we can also look at building design. In North Point, the Housing Society has a housing project for those aged more than over 60. Those flats come with elderly-friendly design. Seniors can use those facilities with ease so that these seniors can live on their own in dignity. There are health centers and a Chinese medicine clinic. There are also services, flats, and care for the seniors with dementia that can ensure timely care and treatment for seniors. The government should look at this model and apply similar services in its own housing project. The government should also get private providers to provide services for seniors. Healthcare aside, there are also integrated services businesses. They can provide seniors with the products, devices they need from day to day. We should have this kind of service providers in public housing estates. We should care for the aged in our family and those beyond. The government should offer plans so that seniors get better services and age in happiness. I so submit and support the motion and the amendment.
Mr. Holden Chow. Madam Deputy, I rise to speak in support of this motion to promote healthy aging to create a good quality of life for the silvered hair group, and also the amendments. I'm grateful to Mr. Adrian HO for moving this motion for us to have an opportunity to have a go at this issue and create good quality of life for the silver-haired group. According to the statistics, in 2046, those above the age of 65, the proportion will hit 30%. Earlier, we were talking about 20%. This is really a staggering increase. In this council, we are debating the aging population. We have been discussing this on more than one occasion. I think to deal with this aging population and to help the senior citizens to live a healthy life, there are certain important points that we have to bear in mind. I think we have to start from our own community. Earlier, the administration rolled out a scheme in which they identified 5 housing estates to put in place the happy design. Together with the district team, we went to Shui Bin Wai housing estate. That's one of the estates to live up to the happiness index. We try to make sure that with a high happiness index, the elderly people will be able to feel it. This is not hard to get off the ground. In many housing estates, it is like this. If you ask the old folks whether they like to have more fitness equipment, they say they would really happy to have them. In the housing estates, they will be gathering together for the morning exercises, and they are open air. They are uncovered. Now, for the senior citizens, these are really nice places for them to gather around. Why did they not have the cover because they don't have to be exposed to the elements, and they can spend their time there in the morning or sometimes in the evening getting together and having a bit of fun there. This is not hard to get off the ground. As I said, if you can get this done, then it shows how much the government is showing them concern. So this is kind of facilities that can be provided. Furthermore, for the senior citizens to live a healthy life, we have the DHC, the district health centers. If we can prevent diseases, there should be more screening exercises. This is being done now, but I think we have to extend the scope to cover more. Other than physical health, and mental health is just as important. Now, when you talk to the senior citizens, you will know that they really want something to occupy their time. If they're willing, if they are idle at home or without anything to occupy them, the consequences can be dire, because if they have mental ill health, there will be a knock-on effect on the physical health, because it is psychosomatic. You have to make sure that they have something to occupy their time. We said last time when we visited the housing estate that we should have some hardware facility. We should have some interest class for them. Now, the old people probably didn't have any time to learn some interest, like musical instruments, some music. They know nothing about it. But when they get old, they have the spare time, and they would like to pick up a musical instrument, and they can form a band and have a jamming session. This is a really good fun for them. This is something that would keep them occupied. And lastly, certain level of employment would be good. If we're not talking about physical exertion, it would be good for those who are above the age of 65. They're only too delighted to get employed, as long as there is no physical exertion. As I said, that this is something that would help the senior citizens as well. Mr. Chen Yong. President, thank you. And my thanks to Professor Sun and other officials. The DAB is all in favor of promoting healthy aging to create a good quality life for the silverhead group. Now, like President Xi said, the Chinese nation has the fine tradition of respecting and caring for the elderly. This is not something for Hong Kong. This is something for all Chinese people. In the 20th Congress report, there is the strategy to tackle the elderly issues, and we should have the fundamental healthcare services for the elderly people. It is something that the nation is setting great store by. Now, we are doing well in some areas, but in other areas, I think we can really collaborate with the mainland. The senior citizens at home are very much like treasures. And in Hong Kong, the population is getting older. People, the life expectancy is very high, not least for the women. Long life should be accompanied with good health, and that's the key thing. In the policy address, it put a lot of emphasis not just on welfare, but also on health care. This is something that the elderly people would really want to see more of. The average life expectancy is one of the highest in the world, and this is something that we're grateful for. However, the elderly would like to have a good life. They like to be aging in place. They like to have security in the twilight years. whether one is happy in their old age would depend on whether someone would have a healthy life in their old age. We have the cross-boundary healthcare services that we have to step up the healthcare services, and we hope that there would be further improvement. Mr. Sun did take the delegation to the mainland to visit some of the facilities, and I think in the future we should further improve the elderly care policies and devote more resources. And I think we could also use the GPA services as well to boost to supplement the services. Now, Ms. Starley and also the NPC deputies will also put forward some ideas about elderly care at the 2 sessions every year. We suggested that there should be collaboration between the healthcare as well as the residential care homes. There are a number of suggestions that I'd like to share with you. The first one is that we should have a smart elderly care. We do have a lot of experts in our midst. I don't propose to repeat it. Second, we should have a comprehensive range of services. We should have the smart services available for the elderly care. And in the community, we should have aging in place. We should encourage the care teams, the neighbors, to help out. We should also train up the healthcare workers to look after the elderly people. And silver economy is also a burgeoning segment of our economy. The old people do have a lot of experience, and they do have a lot of savings, and I'm sure that these would be conducive to the development of the silver economy. And I hope that the administration, like President Xi said, should look after the senior citizens in a better way so that they would have a better twilight years. Ms. Doreen Kong. President, I support the motion moved by Mr. Adrian HO and other amendments. The elderly population is increasing rapidly. We have 1.2 million old people, and thanks to good health care, people are living longer and longer, and they have really lovely family life. But indeed, there are many challenges. The carers are under pressure. The health care institutions, the old folks' homes, and so on, they are facing a lot of challenges. Now, from my observation, I hope that I would be able to offer some recommendations here. The most important thing is to set up more clinics providing a comprehensive range of healthcare services to the elderly. And at the recreational centers for the elderly, there should be better services for the elderly. We should take advantage of the technology. We should have preventative medicine, the management of chronic diseases, and health education so that the elderly people would stay healthy. The elderly services are more fragmented in Hong Kong. There is a need to consolidate them in a way that the senior citizens and the carers would face a more streamlined procedures. I urge the administration to have more streamlined policies. We should use the big data to deploy the resources appropriately. And there should be a wider range of choice in terms of accommodation, particularly the old singletons that lack support. And we have seen instances of elderly singletons passing away in their accommodation. There are some units in the housing estates for the senior citizens, and we can encourage the old folks to support one another and also provide better living conditions for them. we should increase the number of these kind of housing units. The government can also encourage the private sector to take a leaf out of the book of other jurisdictions and build more large-scale facilities and housing accommodation for the senior citizens. For those senior citizens who like to continue working, we should increase the job protection. The life expectancy is very high. People living up to 80-something. Even if someone retires at 60, one will still have to rely on the retirement pension to live out the years. The government should amend the legislation for those beyond 65. If they want to continue working, there should be more legal protection. The employers can be offered higher tax concessions to improve the opportunities for them. And also, there are problems facing the silver hair group. Now, we have seen a lot of online scams involving the senior citizens. They don't have enough knowledge about these fraudulent practices, and they're vulnerable to being scammed. And some scammers would be cheating them out of the money by pretending to be healthcare workers. If they lose all their life savings, not only would they not be able to enjoy their twilight years, it would really cause irreparable damage to them psychologically. So the government should consider offering more protection for large amount transaction. There should be cooling period to guard against scams. Last week at 7 a.m., I saw 4 grannies, and they were hunched back, and they were pushing the carts. They were weaving in and out of the traffic. In Hong Kong, which is so affluent, why is it there are still so many elderly scavengers around town? This is something which is food for thought for us. Thank you.
Ms. Sari Lee. Thank you, President. First, I'm grateful to Mr. Adrian HO for moving this motion, promoting healthy aging to create a good quality of life for the silver-haired group. I believe this is the common objective of the government as well as the whole community. The focus of the motion is how to ensure our old people can live a happy and healthy life. To enjoy good health, you need to develop good lifestyle and health habits when you are young. As mentioned by Dr. Lam and a few other members, primary health care is most important. I cannot agree more. Primary health care can prevent illness. It can also allow our people to understand the differences between Western and Chinese medicine, and they should know about signals, learn about signals from their body, and so they can do something to improve their health. This is very important. We should ensure primary health care, and the government should provide supporting services. The Undersecretary of Health is here. I have been meeting my voters in Kowloon quite frequently. Now, when it comes to aging, the problem is particularly serious in Kowloon. When I electioneered recently, many elders I met talked about health care to me. We've been asking for a general hospital in Wong Tai Sin. It's true that all districts in Hong Kong need a new hospital, but in planning for a new hospital, I hope the administration can give regard to the aging population. It's true that many public housing estates are aging. Now, for Kowloon and Hong Kong Island, property prices used to be higher, and it's natural for new families to move to the NT. So for the many public housing estates in Kowloon, they are really elderly housing estates. Wong Tai Sin, Kwun Tong, and Kowloon City, which I've served for a long time, have a huge elderly population, and they really need a more comprehensive healthcare system to serve them. And QUAT Hospital may, according to administration, be there to serve Kowloon. But if we just rely on QUAT Hospital alone, the situation is going to worsen. First, the traffic link for QUAT has yet to be established, and Queen Mary Hospital or Queen Elizabeth Hospital will be used for specialist services. It may no longer serve as a general hospital. So people living in Kowloon will have to visit QUAT Hospital. You may say that a Kwong Hospital may fill the gap to a certain extent, but given the increase in elderly proportion in Kowloon, the government should plan ahead. Even if you start today, it takes 10 years to build a new hospital. If you haven't promised to build one today, then 10 years down the road, the elderly population will even be higher than it is today. So I hope the Undersecretary has heard our views. In Kowloon, either you keep the QEH as a general hospital or you build a new one. Wong Tai Shin has been complaining that they are the only district without an A&E department. So an ambulance will send patients to a few different A&E departments, and please address their concerns. Mr. Lee Chun-Kang, according to latest figures, in 2022, 1 out of 5 people in Hong Kong is over 65. By 2046, the ratio will grow from 21% to 36%. That is 1 out of every 3 persons is an elderly person. Well, we will all have to age sooner or later. Myself and all of you here will grow in age, and of course we all hope that we can remain healthy, mobile, and live happily when we are old. We also want to enjoy longevity, and when we're old, we want to be able to take up new things or engage in a new job, and also contribute to our families and community. But to a large extent, it depends on whether we have good health. Well, old people will have to face the inevitable, and that is illness. Chronic diseases can be a heavy burden on our public healthcare system. The waiting time for services at our public healthcare sector is increasing. To address this problem, we have to understand why our grassroots need public healthcare services, specialist services in particular. This is because not many of them can afford expensive private healthcare services. They have no choice but to wait for a long time for specialist services at public health care hospitals. So the government must import more overseas trained specialists to address this problem. Take the waiting time for treating cataract is very long. It's also important we develop primary health care by means of publicity, promotion, and consultation. We can help our elderly people to prevent chronic diseases. So we should on a regular basis invite doctors to go to community care centers to give talks on prevention and on screening of different diseases to enhance their knowledge so that they can seek medical consultation as early as possible, and their prevention the sense of prevention can also be enhanced. LCSD has got different fitness facilities for our elderly persons. There is fitness equipment for our old people, but such facilities break down quite often. LCSD will use the excuse of taking a long time to order the spare parts to repair facilities that is broken down. I hope we can learn from South Korea. We can have outdoor fitness equipment, and there should be extra spare parts and components so that the broken facilities can be fixed as soon as possible. We can also organize raises for the elderly. We can give priority to elderly people when they want to book a venue for badminton, table tennis, or bowling, etc., to give them a chance to do exercise. Given that we have a shortage of carers, it is important that we promote sharing technology, because sharing technology can be used in the community. We can have sharing technology centers in all 18 districts to enhance our elderly's understanding. We can have youth ambassadors and also care teams to visit elderly at home to demonstrate to them how such products can be used to enhance their quality of life. The government must make better use of its policies and even big data to promote the silver-haired economy. It should also use data to help elderly singletons to care for diseases such as hypertension and diabetes, to lessen the burden on our public healthcare sector, and to address the problem associated with an aging population. We should educate our elderly person on how to prevent from being cheated, and for the middle class elderly, they are still paying the mortgage for the housing. So we should have policies to help them. Thank you, Mr. Porter. I thank Mr. Adrian HO for his motion, and I thank him for mentioning in his speech that Singapore used cash to help the young seniors aged between 50 and 60 so that they can plan for the retirement. For sure, this is something we can learn from the Singaporean government. Now, we're all concerned about the DC elections. Let me tell you my observations about the voting in the DCs. All governments and political parties would like to secure the support of the middle class. Now, we had a turnout of 1.19 million voters. So for those who chose to be silent or who did not come out to vote are mainly from the middle class. The middle class are those who can fend for themselves the best. They know how to save up for their future. They will do regular body checks to take care of them. However, our policies have a long time overlooked the interests of the middle class. In real life, we have put in many constraints for our middle class. Of course, for the middle class, they have to take care of their elderly parents. They have to bring up their children. They have to pay their home mortgage, etc. In Japan, the most popular kanji is tax. Now, our middle class is starting to be worried about taxes. So MPF, one of the 4 pillars of retirement, is not making profits for them. And we, of course, care for people's health. But if you look at WHO's definition, even as early back as in 1984, they talk about the psychological well-being. In 1984, they started to talk about the personal resources and also physical ability. So health is not just about your physical health, rather your whole person well-being, adaptability, and also the concept of balance and inclusion. So if you are physically very healthy, but mentally you're not healthy, you have anxieties, you're worried, this is not something a happy silver-haired community want to. And as we all know, pressure in society is growing. We can look at the suicidal rates, and some people have chosen to lay back, and this is very unhealthy. We should not just care for the physical well-being of our people, but the mental and psychological well-being as well. This morning, we heard that for those who were less than 65, who unfortunately passed away, now you may know Mr. Lam Chiu Wing and also Mr. Lo Wei Gun, Roman Tam, Anita Mui, Lam Kit Ying, Leslie Zhang, So Hang Xun, and Xing Fui On, etc. All these were artists. Now, unfortunately, they had nothing to do with MPF. The middle class are concerned whether the benefits in their MPF accounts are dwindling. So the point is how we can ensure that our silver-haired group and the young seniors can live happily in Hong Kong. I once proposed to the administration reforms to our MPF and whether we should have a compensation fund for huge losses in MPF accounts. Of course, the administration did not respond. We must take care of the mental, social, and psychological well-being of our people. Now, we are happy, and if we are happy and can live at ease, that is a place where we can call home. If we have too many robberies, now if we can have if we place emphasis on both national security and social security and law and order, then we can all live in peace and ease in Hong Kong, and that is the best way we can take care of the silver-haired group.
Dr. Junius Ho. President, I thank Adrian for reminding us of the need to look after our seniors. There are more seniors, but how do we get this right? It's a big question. Young people go to school, seniors need support. We need to change this. Seniors also need a sense of fulfillment, and the young need opportunities to give play to their talent. Now, some people's hair grows gray even in their 50s, and then by the 60s, they become the silver-haired group. Those lucky can retire at the age of 55, but they have nothing to do. Others retire at 60. Still, these people are active. They have looked after their families. They have supported their children through schooling, and that's done. And since these people have retired, they are done with working. They have extensive experience in life. They have built up wealth, even if that means they live in a small flat. They have paid off their mortgage by then. So these are people of means, and they are still relatively healthy. Decay kicks in at the age of 70. For those in their 60s, before they turn 70, these people are still active. How do we get things right for this group? So instead of giving out old age allowance or OAA, we should think of something else. Seniors have contributed to the community, so we give them the OAA. But OAA payments go on and on with no end in sight. And then we have the $2 transport fare scheme. is it a waste of public money? We wanted to honor our aged, but that seems no longer what it is. People start to take the $2 scheme for granted. Since that's the case, why not fix the scheme? Let's encourage the silver hair to be volunteers. Let's give these senior volunteers some kind of incentive or easy money, so we can tap into this pool of labor. When they do more work, they get more incentive pay. We can pay these senior volunteers by the hour. That will work better than where we are at, because the pay for these volunteers will be lower than a regular worker. We can have a large pool of such senior volunteers. They can help people out. We can have intergenerational harmony. These senior volunteers can help look after young children and cooking. Mr. Porter raised the issue about MPF. Dr. Johnny also discussed this. The MPF payments are just sitting there. My worry is that a person has passed away before they can withdraw their MPF payments. So after the age of 55 or so, we should let people withdraw their MPF balance for health insurance or for public health care, so that people can choose between public health care and private hospitals with their MPF balance, and then these people can go on to become volunteers. That's why I've been calling for using the MPF balance. President, I so submit. I support this motion. Does any other member wish to speak? Mr. Adrian HO, you may now speak on the amendments. Thank you, Madam Deputy. I thank Dr. Johnny Ms. Elizabeth QUAT, and Professor James Lau for their amendments. Their amendments add color to the motion. I support the amendments. I also invite members to support my motion and all amendments. I so submit. Undersecretary for Health. Madam Deputy, I thank Mr. Adrian HO for moving this motion, and Dr. Johnny Ms. Elizabeth QUAT, and Professor James Lau for moving the amendments. I also thank the 30 or so members for speaking on this topic. They have spoken on healthy aging and especially the healthcare aspect of it. With social advancement and advancements in medical science, people are living longer. Hong Kong's life expectancy is also among the longest across the globe. We want not just longevity, but living longer in good health. And this is something echoed by Mr. Chen Kin-po. Healthy aging falls into the policy areas of many bureaus. We want seniors to get better care in their twilight years. As Mr. Adrian HO said, we should start young. When we start looking after our health, we need to plan, we need to focus on prevention, develop a healthy lifestyle. I also agree with Mr. Kitson Young that staying healthy requires a kind of mindset. So there has been changes to Hong Kong's healthcare. We are shifting to prevention before cure. So we focus on prevention. So we want people to quit bad habits like smoking, drinking, and lack of exercise.
so as to lower the chance of contracting these diseases. Now, I would like to respond to members' comments. First, to address the problem associated with an elderly population and rising number of chronic illness, the government announced the blueprint for primary health care last year, introducing a number of reforms so that we focus on prevention, and we will rely on an early identification and early treatment system, and so as to develop a sustainable healthcare system. And in Hong Kong, we have also got district health centers, and we've also got district health stations covering all 18 districts. Now, for these HCs, they provide primary healthcare based on the gender, age, and lifestyle of citizens concerned. They have different health plans for implementation of healthy habits. At different age groups, different kinds of vaccinations will be proposed, and different cancer screening and screening for chronic diseases, and to develop personal health plans to achieve prevention. For those who are over 45 years old, I appeal you to join this collaboration program to deal with chronic diseases such as hypertension, and will gradually enhance our primary health care services. Now, for elderly centers, we have elderly health centers using family medicine as the basis. We have a cross-disciplinary approach to provide basic healthcare services for the elderly so that there can be early identification and control of diseases. For those who are over 65, there will be integrated primary healthcare system, including risk assessment and also prevention. And the Department of Health's elderly health centers will collaborate with the HA's services so that people can have access to more convenient and expeditious service. The Department of Health has got some plans tackling different needs of the elderly so as to delay the age of losing the functions. There are volunteers to do home visits to identify elderly persons that are prone to falls, and to improve to suggestions to lower the risk of falls, and to enhance carers' skills to support aging in place. To support the healthcare needs of the elderly, since 2009, there has been a medical voucher scheme. So for Hong Kong permanent residents over 65 years old, they're eligible for $2,000 of voucher, and they can accumulate up to $5,000, and then they can use the voucher for patronizing private healthcare services so that money follows the person. And this will also promote the concept of family medicine. Under the blueprint, we will further improve the use of the healthcare voucher scheme to ensure that such vouchers can be used on healthcare management. In November, we launched a 3-year pilot scheme. $500 would be dispersed to any elder who have used the voucher to buy specified healthcare services. Starting from July this year, eligible elders can share their healthcare vouchers with their spouse. The government attaches importance to the mental well-being of our elders. The Mental Health Advisory Committee in 2007 launched the Shall We Talk public publicity and education scheme. This is a one-stop website. There is a particular page for the elders with information for them. And together with RTHK, we've also got programs to discuss common mental issues of our elderly persons. And so members of the audience will know where to turn to for help. For elders with dementia, in 2017, we started a pilot scheme for collaboration between the social welfare sector and also the healthcare sector. Elders that have a mild to moderate dementia, and their carers can have access to such services. In 2019, the services were regularized to cover all district elderly centers run by the SWD, benefiting over 2,000 elders and their carers. Health is wealth. The Health Bureau continued to use various initiatives to enhance the physical and mental well-being of our elderly persons so that they can have a golden retirement and develop healthy habits. I now defer to the Secretary for Labour and Welfare to speak on his portfolio. Thank you.
Secretary for Labour and Welfare. Madam Deputy, once again I thank Mr. Adrian HO for moving the motion, and Dr. Elizabeth QUAT and Dr. Laji Pang for moving the amendments. 37 members have spoken today. It goes to show that given the aging population and the challenges arising from that, members are very concerned about this, and members are not merely focusing on the challenges right before our eyes. Members are really far-sighted in their comments, and certainly we will consider them as we go away. In fact, 1 in 5 of Hong Kong people are elderly people, and many of them are above the age of 84. Now, we are talking about the life of the elderly people. I think we can look at it from a number of angles. The first one is to have better life for the senior citizens. I'm talking about those who still have their abilities. And for those who can work, we encourage them to hold down a job and work continuously. And the second category is those who are suffering from ill health and they need care and attention. We have 214 the neighborhood centers with a membership of 270,000. We have incorporated this into the Hong Kong Planning Standard and Guidelines. In the newly developed areas, we do have these kind of neighborhood centers or district centers for the elderly in proportion to the number. The other thing is the elder academies, as members alluded to. In the policy address, we're going to be injecting $80 million into this. We've also raised a donation to the tune of $11 million, and it shows that elder academies represent a very effective measure to provide an opportunity for the senior folks to engage in learning. We have some learning classes. Now, some senior citizens didn't get a chance to go into university in the younger days, and they can also get a taste of life as university undergraduates. So this is a very good way to help them to live a meaningful life. Now, members mentioned the allowance. We have 700,000 senior citizens who are getting the OH allowance, 40% of the population. If you consider the other allowance, 3 out of 4 of the senior citizens are getting different forms of allowance, and this is $50 billion in aggregate. So the government has really devoted enormous amount of resources to this. Now, we are concerned that when people are getting older, the connectivity, accessibility in the community is also important. The Chief Executive has, in the policy address, proposed that age-friendly building design should be in place, which is headed up by the Deputy Financial Secretary. In the building design manual of the Building Department, there would be considerations given to accessibility and connectivity, and this is an important initiative there. In terms of employment, those aged 60 or above, 24, they take up 24% of the population. 1 in 4 is still working, more men than women. So this year, as you can see we have this allowance scheme for employment. Now, if people have not been in the workforce for 3 months, we have the re-employment allowance, and if they stay in job for 1 year, they will get $20,000. And through these means and also the business-friendly policies, we hope that more elderly people will be joining the workforce. And members are also concerned about the care. Now we have the care homes. 4% of the population, elderly population, are living in the care homes, slightly higher in Hong Kong, the world over. We're talking about 3% or thereabouts, 60,000 elderly people are living in the homes. We will be continuing with our planning to make sure that more homes will be provided. One of the most important initiatives is that in the future housing estates, 5% of the floor space would have to be devoted to welfare services. A significant portion would be devoted to care homes and the community care purposes. So rather than the residential care homes, we also have the community care, and these are center-based or home-based. Now for center-based, if they travel to the centers for home-based, and we will be reaching out to them, or they can get the community care vouchers. This has been regularized. In 25-26, it's going to be 15,000 vouchers that will be distributed. So there will be a wider range of choices. Now for the elderly singletons, doubletons, the number will be reaching 500,000 going forward. What we are concerned about is whether they are aware of the availability of the services. So next year, we will be collaborating with the care team in the Southern District. We'll be visiting these elderly singletons and doubletons. If they experience difficulties, we'll be referring them to the relevant units for follow-up. If need be, we'll be installing the emergency link for them. It is important policy to help the elderly to live out their life healthily. Now, in the INT fund for application in the elderly, there would be an additional $1 billion injected, and we will be extending the Tech to home-based care. Now, there will be assistive technology products that can also be used in a home setting. Members also talked about the cross-boundary elderly care. We have the Guangdong Care Home Center. This will be extended. We have extended these to the private homes for these residential care home in Guangdong, and this service will be extended further to the homes in GBA. They may not have any track record in Hong Kong, but in the GBA, if they measure up to the expected requirements, they will also be entitled to join this particular scheme. I appreciate that members are concerned about the silver economy, that the CEDB is responsible for that. In the coming year, they will be setting up the advisory committee on silver economy. They will have experts looking into this and making recommendations. The CEDB will seriously consider members' views put forward today and follow them up accordingly. President, the challenges facing us relating to elderly or aging population are really stark. We are having a higher elderly population. Now, this is nothing to be afraid of. As long as we rise to the challenges, we will be able to come together and rise to all the challenges arising from an aging population. We should seize the opportunity to take advantage of the business opportunities and create more wealth for the community. With these words, I conclude my speech.
I now call upon Dr. Johnny Ng to move an amendment. President, I move an amendment. I propose to question you that Dr. Johnny Ng's amendment be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Ms. Elizabeth QUAT, as Dr. Johnny Ng's amendment has been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Ms. Elizabeth QUAT's further amendment be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Professor James Lau, as the amendments of Dr. Johnny Ng and Ms. Elizabeth QUAT have been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Professor James Lau's further amendment be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Mr. Adrian HO, you still have 1 minute 43 seconds to reply, and then the debate will come to a close. Mr. Adrian HO. President, I thank the 30-odd members who spoke on my motion and the 3 amendments. Members shared great insights. I also thank the Secretary for his active response to the motion. I hope that after this motion debate, the government will be even more active in looking at aging policies so that Hong Kong will become a place conducive to childbearing and aging. I so submit, President. I hope members will support my motion. I now propose a question to you that Mr. Adrian HO, as amended by Dr. Johnny Ng, Ms. Elizabeth QUAT, and Professor James Lau, be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the motion as amended passed. Members, we may not have enough time for the next item on the agenda, the next motion debate, that is, the one about proactively responding to national development strategy by following up on the development of the northern metropolis. To ensure we can have a full debate, I consulted Ms. Chen Yutming. We will not start the next motion debate. This council meeting is the last one in this legislative session. I wish legislative members and members of the Republic Merry Christmas and Happy New Year. I adjourn the meeting now. The next meeting will be held on January 10th, Wednesday at 11 a.m.